Also in the medium term, we can start without estrogen to gain weight and gain it in a very strange place, a non-female place. We start to strap on weight around the middle. And this is male type fat distribution, because fascinatingly, for reasons that are beyond me, when our ovaries completely stop producing estrogen, our main female hormone, they go on, very kindly, producing testosterone, the male hormone. And so we get out of proportion, if you like, when we suddenly go through the menopause. And although the testosterone level is gradually declining with time, we become estrogen depleted suddenly. And so our ratio of testosterone and estrogen goes wrong, and we start to strap on male type fat, spare tire around the middle. And we don't like it. And not only do we not like it, but it's an independent risk factor for heart disease and stroke. And I'll tell you more about that in a minute, and that's very important stuff. Now, in the long term without estrogen, we all get bone thinning and an increased risk of what we call osteoporosis. Without our female hormone, we also have an increased risk of what we call cardiovascular disease, heart and vessels, heart disease and stroke. And the reason I put a question mark at the end of that is that we used to be completely clear that this was a postmenopausal change, and therefore that using HRT would protect women from that. Without estrogen, for many of us, there will be quite a profound risk of Alzheimer's. And I think one of the things that we're not aware of in this country is that if we reach the age of 85, as women, 1 in 2 of us will have Alzheimer's. Most women are completely unaware that going into the post-menopause and losing estrogen increases our risk as a woman of having colorectal cancer. In other words, estrogen as a hormone is protective from cancer of the colon and the rectum. We'll also develop a decreased rectal closing pressure. What am I talking about here? I'm talking about the fact that we may well develop incontinence of the bowels as well as incontinence of the bladder. And this is a subject, again, which very few women talk about and very few women know about. We get changes at the back of the eye. So a lot of women develop macular degeneration, and loss of estrogen speeds cataract formation. The ability of our wounds to heal and our skin to heal changes after the menopause and becomes much poorer. And we also lose our ability to quite know where we are in space, so that we tend to fall more. Now, of course, if we are osteoporotic, this is the thing which is going to be crucial as far as whether we're going to fracture something or not. We get changes in our teeth and our gums, but, and of course, this is the important thing, when we lose our estrogen hormone, we reduce our risk of developing breast cancer. Now, this is a very complicated thing to understand, because our risk of breast cancer increases with age. So as we get older, far more of us as women will develop breast cancer. But if you were to take 2 women of 55, one of whom was menopausal and one of whom was still having her own periods and still having her own cycle and still had her own estrogen on board, the woman who actually had estrogen on board from her own periods would be at a slightly higher risk of developing breast cancer than the woman who 5 years ago had stopped having periods and had no estrogen. So if we go through the menopause, although we're getting older and our risk is getting up with time, getting higher with time, and we can't help that, if we become postmenopausal, our risk will tail off a little bit. And therefore, it follows, the story goes, that if we choose to use HRT and replace our estrogen hormone, we will be keeping ourselves at that higher risk. And I'll tell you more about that. And of course, the other thing that happens when we go through the menopause and the change is that we end up at a slightly lower risk of having a blood clot. And again, this is one of the things that always hits the papers, that if we use HRT, we will be at an increased risk of having a blood clot. In fact, the newspapers are quite clear, and they tell us that we will be at 2 to 3 times the normal risk of having a fatal blood clot in the lungs, which actually is true. And I'm going to explain why explaining risk like that is such a bad idea. But let's look for a minute first at bone, just for a second. This, you'll be pleased to know, is some healthy female bone. It may not look very healthy, but it is. What we have on the outside of that normally, in a long bone, like the leg bone, is something that's like a step ladder. We have an outside casing, and these are the struts holding it all together. Now, what happens as we lose estrogen and when we go into the menopause is this. And you can imagine that that is not going to bear the same kind of strain. And so that is the kind of bone that will fracture. Now, if we look at medical x-rays, what we will very often see is an x-ray of an old lady's spine where she has this huge curvature of the spine. But of course, I'm dealing with live women, and it's this that we're dealing with. Now, by this stage, the pain, by and large, has gone. It's burnt out. But in the early stages, the pain is phenomenal. But the quality of her life, trying to live like this, is really, as you can imagine, quite changed. And of course, hip fracture in old age has the largest impact of any type of fracture, with, interestingly, a death rate of about 1 in 5 women, mostly in the first 6 months, mainly due to complications of the fracture or the surgery, because, of course, you can develop blood clots afterwards because of the immobilization. And many women suffer because they've lain on the floor for a long, long time before they're found. I tell you about the osteoporosis, obviously, because it's one of the components of our decision-making about what we choose to do or not to do in the post-menopause. But if we're going to look at heart disease and stroke, I think one of the things we have to remember that heart disease is the leading cause of death amongst postmenopausal British women. And 1 in 2 of us who reach the age of 50, I won't say hands up girls, but 1 in 2 of us will eventually die from heart disease or stroke. So it's very important that we understand what's going on. And of course, we all know that lifestyle changes are the most important things. But what happened was very, very interesting, because back in the mid-80s and the early 90s, we were actually saying to women who were at particularly high risk of heart disease and stroke, well, one of the things you really should consider in the postmenopause is using HRT, because HRT is protective from heart disease and stroke, and in fact can probably reduce your risk by 30 to 50%, which sounds very, very dramatic. Now, were we saying that because we were wrong? Well, no, we weren't. We were saying it because the only data we had to go on in the late 1980s and the early 1990s was what we call observational data. We had lots of data on women who had chosen to use HRT, and we could compare that with women who had chosen not to use HRT, which is very valid. And we had data going back over years and years and years. And the women who'd chosen to use HRT had this very much reduced rate of heart attack and stroke. So it was quite a reasonable assumption to say that HRT is protective, and replacing our hormone is protective from this major life event. And of course, the problem was, everyone would say to us, well, what is the actual effect of estrogen in the blood vessels, in the heart, in the brain? And the mechanisms were so complex we could never pick out one thing. It must be multifactorial. But now we are at a stage where we are not making those suggestions, because in 2004, our Committee on Safety of Medicines in the UK issued an edict to all doctors based on the publications of a big trial from the Women's Health Initiative in the States. And the trial had stopped early. And it had stopped early because of the potential risks of HRT in this extremely large trial that I'm going to tell you about. So our Committee on Safety of Medicines, our CSM, issued an edict to all doctors. It was cascaded to all doctors' surgeries as an urgent message that HRT should only be used for the short-term treatment of menopausal symptoms, and we need to use the minimum effective dose for the shortest possible duration. It's not actually a very helpful statement. I'd love to know whether they meant half a tablet once a year. I really don't know. But anyway, that's what the statement was. And then they said the balance of risks and benefits of HRT when used in the long term for preventing osteoporosis suggest it should not be used as first-line therapy, which means the primary treatment that you choose. And it was, because it was so gentle and natural compared with lots of the other treatments that women and their doctors were choosing it. And we're now being told we must not. Then the CSM said, HRT is of no benefit in healthy women without symptoms. They moderated that slightly, and the current statement reads, in healthy women without symptoms, the risk-benefit ratio is generally unfavourable. Now, this big study from the States, the WHI, Women's Health Initiative, what they were looking for was heart disease, brilliant, breast cancer, brilliant. Colonic cancer, even better, because it's the first big trial we'd had which recognised that HRT might be protective from colonic cancer, and fracture rate rather than just bone mineral density rate. So these were 4 very good endpoints. And suddenly, and it was supposed to run for about 10 or 15 years, it was stopped after 5.2 years. And the reasons that it was stopped were this. And I want you to imagine that you're sitting reading your daily paper and you pick this up. And it says, HRT increases your risk of breast cancer by 26%. It increases your risk of heart disease by 29%. It increases your risk of 41%. It increases your risk of stroke. You tell me if you're going to swallow your next tablet of HRT. A 41% increased risk of stroke by taking it. So of course women stopped taking HRT. There was a 22% rise overall in cardiovascular disease when the trial was stopped, double the risk of blood clots. Now, this is when my alarm bells started to ring, because I've been involved in contraception as well as HRT for most of my working life. And we've had a lot of scares about contraception and the pill and risk of blood clots. And the last big one was all to do with a doubling or trebling the risk of blood clots.